How has your home health background shaped the way you look at hospice differently than someone who started directly in hospice?
Well, I think what I realized, I remember I woke up one morning and I was like, man, there's so many patients that are in home health that should be in hospice. And I always knew this from the home health world, but it really dawned on me there's so many of them that are hidden away in home health. And what is it that we can do? How can we help to grow that hospice census by looking at that home health population? I also realized in this role how critically important it is for home health clinicians to be well versed, not only like in the hospice benefit, but also how to identify the patients and families who might be appropriate and would be well supported by hospice.
One of the things you mentioned in our call that stood out was the connection between home health and hospice. I think you said home health often has a significant hospice census within
Mhm.
its current patient base. What do you mean by that?
Well, I have found that many people, as they get closer to the end, they're really struggling with being emotionally ready, and so it feels safer to say, "Well, I'm gonna go to home health." It feels a lot safer. It's not quite as death and dying as hospice. I'm gonna try home health for a while. I'm gonna try a couple PT sessions and see if that helps. And so they will often land in the home health space because it's safer for them. It's probably easier to get them there because it's not involving conversations about death and dying, which are things that we're not necessarily good at. So they feel like it's a safer choice than hospice, and it just kind of happens to be a natural progression. In reality, if we had taken the time ahead of that to really sit down and explain kind of where they were in their healthcare journey and what that looked like and what the hospice benefit maybe could offer them, they may make a different choice if they truly had informed consent. But often it's easier to not have those conversations, so people will end up in home health. And so, and they receive amazing care in home health. I mean, I can't speak highly enough about home health clinicians. They do a great job, but the patient has a different need set that maybe they aren't as well versed in, and so that's why hospices ultimately can be the better choice.